Hi, in this video, we will understand the feeding of sick babies and or preterm babies with a feeding tube or spoon feeding. Feeding tube is also known as intragastric tube because the tube directly goes into the stomach of the baby, and the spoon feeding is also known as Paladai feeding. So some babies cannot directly breastfeed from the mother, like the preterm babies, the low birth weight babies, and babies with structural or neurological diseases, which makes them unable to suck the milk from the mother's breast. So in these babies, we use feeding tube. So in preterm babies, they have inadequate feeding skill due to lack of coordination between sucking, swallowing, and breathing. So they may breathe while swallowing the milk. And they have higher fluid requirement due to excessive water loss. Their skin is not mature, so a lot of water is lost from the skin. They have low body stores at birth and they require supplementation of various nutrients. So the feeding method depends on the gestational age of the baby. In babies with gestational age less than 28 weeks, there is no proper sucking effort. So these babies are started on IV fluids and very minimal feed by feeding tube. Babies with the gestational age between 28 to 31 weeks, the sucking burst first is developed, but there is no coordination between sucking, swallowing, and breathing. So these babies are also fed with a feeding tube. And babies with gestational age 32 to 34 weeks, they have a slightly mature sucking pattern, and the coordination between breathing and swallowing starts. So these babies are started with a small amount of spoon feeding. And babies with gestational age more than 34 weeks, they have a mature sucking pattern, and they have more coordination between breathing and swallowing. And these babies are definitely fed with spoon feeding, and the breastfeeding is also started. So these are the different routes of administration of feeding. The babies who are very small or having breathing trouble are fed with feeding tube, and babies with who are slightly bigger are fed with a spoon feeding or Paladai feeding. This is the Paladai feeding. And babies who are more bigger or mature, they can directly feed from the mother. So again, the same thing is being told. Less than 28 weeks, we start with IV fluid. 28 to 31 weeks, we start with tube feeding. 32 to 34 weeks, we start the spoon feeding also, apart from the tube feeding. And more than 34 weeks, we start the direct breastfeed also, apart from the spoon feeding. So regarding tube feeding, the tube can be passed through the mouth or through the nose. And in NICUs, the tube passed through the mouth is preferred over nose, because if the tube is passed through the nose, there is increased airway resistance and the work of breathing is also increased. So we prefer tube feeding through the mouth. So to insert the tube, we first measure from the baby's nose to the tragus of the ear and then to the midpoint of the sternum and the stomach. And once the measurement is taken, we insert the feeding tube in a sterile manner. And after the feeding tube inserted, we attach the syringe to the feeding tube and pour the milk into the feeding tube and allow the milk to gradually flow by gravity. So first we place the orogastric tube feeding. We check the correct placement by using a stethoscope, and we push a small amount of air through the syringe and try to hear the air through the stethoscope from the stomach. If it is there in the stomach, then you can hear the hissing sound of the air. Now, attach a 10 ml syringe without the plunger and then pour the measured amount of milk and let it trickle down by gravity. Place the baby in left lateral position for 15 to 20 minutes after feeding tube. This is to prevent the regurgitation of milk after the feeding is done. Avoid flushing the tube with water after the feed, and pinch the orogastric tube during removal. Measure pre-feed abdominal girth. Do not attempt a pre-feed aspirate. That means you have to measure the abdominal girth or the circumference of the baby at least every 2 hourly, and do not aspirate milk that is already gone into the milk unnecessarily, into the stomach unnecessarily. Now coming to the spoon feeding, this is also known as the Paladai feeding. It is a small bowl with a long pointed tip. It is traditionally used in India and in other cultures also to feed low birth weight babies. Now, Paladai feeding, the baby should be awake. Mostly they are asleep because of their prematurity. They are held in sitting or upright position, and the arms are wrapped and to keep the arms out of the way, and put a measured amount of milk in the Paladai. Hold the Paladai so that the pointed tip rests slightly on the infant's lower lip. Tilt the Paladai to pour a small amount of the milk into the infant's mouth and feed the infant very slowly. Make sure that the infant has swallowed the milk already before giving any more. And when the infant had enough, he or she will close his or her mouth and will not take any more. Do not force feed the infant. To estimate the amount of milk taken, subtract the milk left in the cup from the original amount. Also subtract the estimated spillage, if any. And wash the spoon and Paladai with soap and water, and then put in boiling water for 15 to 20 minutes to sterilize before the next use. The advantage of Paladai feeding is that it is faster than the spoon or cup feeding, and there is less spillage. And there is greater physiological stability, lower risk of having low heart rate or bradycardia or low oxygen saturation. So disadvantage is the caregiver has to be very careful to avoid pouring large amount of milk into the infant's mouth. And when Paladai feeding is correctly done, there is no evidence that there is an increased risk of aspiration. Now, trophic feeding. Trophic feeding is giving small amount of volume of milk to stimulate the bowel, but it is not intended to contribute to nutrition. And even if the baby is not cried at birth or having fast breathing or infection or low blood pressure or glucose disturbance or ventilation or umbilical lines, it is not a contraindication. You can give trophic feed. Now, for the first day of life, if the baby is very high risk, then we give very small amount of feed. Otherwise, we give a little more amount of milk and we gradually increase to full feed so that we can stop the IV fluid. And after we start the IV fluid for the very small babies, we start with a small amount of milk also, and then we gradually increase the milk through the feeding tube and gradually start the feeding by spoon feeding also. Then we increase the spoon feeding and stop the tube feeding, and then we straight away go for direct breastfeed along with spoon feeding and gradually stop the spoon feeding also. And always try to remove the gas after feeding by burping, and burping can be done by holding the baby against the shoulder of the mother or keeping the baby in a sitting position and gently tapping on the back. The head and the upper part of the body should be swaying or should be laying towards the front of the body, tilted towards the front of the body so that the gas comes out from the stomach easily. So with that, thank you for your patient listening. Hope this video you understood how to give feeding in a preterm baby or a sick baby.